If you're just turning 65 and have access to Medicare, is different than if you're looking into assisted living. So let's just start with the beginning. For a new person into Medicare, how do you guys? Hi everybody, I'm Camilo Lopez. I'm the founder of King Companions, and we help seniors and their families navigate through the aging process. Today we have Desiree. You help families go through the Medicare puzzle and labyrinth of all the information. So I'm excited to have you and learn more about it because I'm also learning about this topic. Welcome, and thank you for coming.
Thank you for having me today, Camilo. My name is Desiree, and as Camilo said, I do help individuals navigate the crazy world of Medicare. I assist individuals who are approaching the age of 65, basically help streamline the process. There's so many steps behind Medicare. There's Medicare A and B and all the letters that go with it. I also do assist individuals who are currently on Medicare navigate that world as well, because not only is their health changing, but the plans are changing. So I really do sit down and make sure that they are on the appropriate plan for their needs.
Mm-hmm.
So
yes, it's interesting. In my case, I'm super interested in our conversation because my mom is in her late 70s, and so she's been in Medicare, but our approach has been find a brand that we trust, sign up with it. We don't know what the difference are between plans and all that, but as I learn more, there's a lot that has to go through it.
Yes.
So I'm gonna ask you questions for the audience as well as for myself.
Wonderful.
So let's start. So one of the things that I saw on your website is that you focus on bringing clarity in this process, which is so important. There's so much information. You probably are receiving hundreds of mailers with buy me information on different plans, and it's overwhelming. So bringing clarity is key.
Yes, absolutely. Usually in my first meeting with individuals, I actually do sit down with them and we do a simple Medicare 101 where I really do dive into like what's Medicare Part A and what's Medicare Part B and what that coverage entails, and then really the differences between a supplement plan and an advantage plan.
Yes.
So that's that clarity piece that I bring to the table to make sure that the individual is fully aware of all their opportunities.
And we'll cover that in a minute. The other aspect is that because you work with many insurance companies, you help them really navigate that process pressure-free. So you just know that you're trying to sell one thing or another. You're trying to help each person for their unique case, right?
Yes, and my services are free of charge. That basically what being a broker means is that we do represent most plans and carriers. So we do not only represent one carrier, we represent multiple carriers. And what's nice about that is as we're sitting down with an individual, we are collecting information such as prescriptions and doctors and verifying that information, and then basically looking at all the plans out there and finding the right plan that fits that individual.
Fits that person. Mm-hmm. Okay, sounds good. Okay, so let's start diving into what Medicare is, Part A, Part B, Part C, Advantage. So guide us through how, and because I also think the conversation is different in which phase of the aging process you are, right? If you're just turning 65 and have access to Medicare, it's different than if you're looking into assisted living. So let's just start with the beginning. For a new person into Medicare, how do you guys?
Sure. Like I mentioned earlier, I do sit down with the individual and I do a Medicare 101. They're usually very overwhelmed with what is A, B, what's an Advantage plan, what's a Medigap plan. So truly, I'd sit down and do a Medicare 101. I cover Part A, which Part A, just kind of give us a little rundown, is Part A is actually your hospital coverage. Okay. That does not have a monthly premium as long as them or their spouse have worked 10 years or 40 quarters. Part B, as in boy, that is your outpatient care. So that does have a premium, and that is solely based off of your tax bracket and how you filed your taxes 2 years ago. So the government always looks back every 2 years and how you file. For the year of 2025, the national average, what majority of people are paying is $185 for their Part B premium a month. And if you're pulling from Social Security, that Part B premium comes out of their Social Security check. If they're not pulling from Social Security, they will be billed quarterly for that. I can't stress that word enough. And so, for example, if they're not pulling from Social Security, they will get a quarterly bill for, if they're at that 185, they will get a quarterly bill for $555.
That can be a big bill for a lot of people.
Yes. So I want people to be fully aware of that. Once they get that first bill, they actually can call Medicare and change that to monthly, but that first payment is a quarterly bill.
Okay. So Part A is the hospital. So that's not your doctor, your regular doctor. That's Part B.
Correct.
And is there copays for that to see your doctor?
So that's a great question. So Part A and Part B, the most important thing is that is only an 80% coverage. And so most people think that since they have their little red, white, and blue Medicare card, that they are on Medicare, they're covered, they're fine. But A and B is only an 80% coverage.
Okay.
So we want to make sure that we either set them up with either a supplement plan, also known as a Medigap plan, or a Medicare Advantage plan. So those help to supplement that 20% that's not covered, because there's no cap on that. And so in the event that something catastrophic were to happen and they were only on Part A and Part B, there's 20% of that there's no cap on.
Okay.
And so once an individual is signed up for Part A and Part B, that is where I come in, is I help to educate them between a supplement plan, again also known as a Medigap plan, or a Medicare Advantage plan. So
what's the difference between Advantage and Medigap?
I know, so many questions.
Yeah.
The supplement plan, those are going to be your lettered plans, where you may hear friends and family say, I'm on Plan G, or I'm on Plan N, or I'm on Plan F. Those are going to be your lettered plans. Now, those are going to have an additional monthly premium in addition to your Part B, as in boy.
Yeah.
What that means is Medicare is your primary. So in the event that you had to go to the doctor's office or you had to go to the hospital, they're going to bill Part A and Part B first, and then they are going to default to your supplement plan. Okay. So for instance, your Part G. And so from there, you wouldn't have any copays. They will bill your Part G. And then there's a one-time annual deductible if you go this route. And for the year of 2025, it's $257. And usually that's met in their first doctor's visit.
So what are these other parts? I know you mentioned like the alphabet there,
Yes.
but how do you know what's ABC? So C is for medicine, right?
Well, so Part C is the other option.
Okay.
So Part C is the Medicare Advantage plan.
Okay.
And I wanted to get to that in just 1 second. So with the supplement route, there's one more letter.
Yes. Okay. What are the letters?
What are the letters? So you have A and B.
Yes.
And then option 1, if you decide to go that route, is the supplement route. And I'm going to use Part G as the example here because it's the most coverage.
Okay.
Where there's no copays. But that will have a premium.
That's
in
a
addition.
$250.
Nope, so that has an additional premium, and that is contingent upon quotes at that time, but I would say roughly on average it's $150 to $200 on the higher end per month.
Okay, so that would be the $185 plus the $200 for Plan G. Okay.
Yep. Then you also have to have a prescription drug plan. Regardless if you're on prescriptions or not, that route, option 1, the supplement route, you do have to have a prescription drug plan. And that is known as Part D. So think D for drugs. Now those do have a monthly premium as well, but they can range anywhere from $0 up to right around $150 per month. Depending on their prescriptions, the drug formularies, and that sort of thing. And that's all part of my job, is I do help to collect doctors and prescriptions, and I do help to find the appropriate drug plan for an individual.
Got it. Because then the cost of the drugs can different insurance?
Yes, so there's prescription drugs they're basically organized in tiers. And so there's 6 different tiers in the prescription drug world. And so tiers 1 and tiers 2 are usually your generic, your preferred generic, which have little to no copays. And then tiers 3 and up are more of like your name brand, your specialty tiers, that sort of thing, which do have tend to have a higher copay because they are the name brand. And so what I do is I collect prescriptions, and then I'm able to take that information and look to see what tiers they are to make sure that those drugs fit into the formulary of the insurance carrier. So that's very important to make sure that they are covered within that insurance carrier.
Got it.
So that's option one. I also want to add to that option one, the supplement route, it does not include dental, vision, or hearing. So that would be a separate premium. Okay, so it's just medical. So if you need a dental, vision, or hearing, that would be in a separate premium. I'm also able to help assist get that set up as well.
How about mental health?
Mental health is covered underneath the medical part of that. Yeah.
So if you're deprived, because I think when many people retire, they go through a depression phase. Is that covered by then Plan B?
So that would be considered outpatient, yes. So that would be all covered underneath your Part B, that kind of thing, for sure. Absolutely, that's a great question.
Okay, so now we have a supplemental route. So that would be Plan G, which is the one that covers the most. So just roughly back of the envelope math. So you have the $185 for Plan B. Plan G will be another roughly $200 a month. So
on the higher end, yes.
Yes. So roughly we're in the mid 300s. Plus Plan D for drugs. So now you're thinking about a monthly healthcare bill just for insurance of roughly maybe $300 to $400.
Sure, maybe $450. Again, just depending on that prescription drug plan. That is monthly. So, but what that means is that you can go anywhere that accepts Medicare. So it's not a network base, so you can actually go anywhere that accepts Medicare. And
so that with the Plan B plus the supplemental, that will cover 100%.
Absolutely. Yep.
Okay, so that's the.
That's why we want either a supplement or an advantage plan to help cover that 20% that A and B doesn't cover.
Yeah.
So, and then the other option is the Medicare Advantage plan. This is known as Part C. So think Cadillac plan.
Okay.
C for Cadillac. They include dental, vision, hearing, and the prescription drugs. So again, one big bubble, one big Cadillac plan.
Oh, that covers everything. So if I go through the Plan C Advantage, that's just everything and 100%?
Everything at 100%, yes. And so these typically don't have a premium. And if they have a premium, it's very minimal, maybe $50, $60 per month. But majority of the Advantage plans do not have a monthly premium. And so people are like, well, there's nothing free in life. How do you pay for your Advantage plan? So these typically you pay as you go in a copay. So if you had to go to a primary care doctor, there's no copay. If you had to go see a specialist, it's anywhere from $10 to $30. If you have to have a surgery, there's a copay for that. If you had to stay as a patient in the hospital, there's a copay for that. But what all these people are like, well, I don't want to pay $1 million in copays for a year. You are protected by what we call a max out of pocket. Okay, so you're fully aware of what that is as you are going into an Advantage plan. These are network based, so they're an HMO and a PPO. An HMO is a health maintenance organization, which means you have to stay within network of your doctors. A PPO is a preferred provider organization, and that gives you the flexibility to go in and out of network. On average, the HMOs max out of pocket, so the most that you would pay within a calendar year in copays, because they all add up. On average, that's $3,500 to $5,000, and that's the most that you would pay within a calendar year.
And that's if you use it. So if you didn't use it, then there's no copay.
Yeah.
And for the Advantage, so you don't have to pay that $185 for Plan B.
You do. So
you
do still have to pay for Part B, that $185.
Oh, okay.
But there's not an additional majority of the time, there's not an additional monthly premium for that Advantage plan. Again, if there is a premium, it's very minimal, like $50, $60.
Got it. Okay. So let's summarize kind of this conversation.
Yes. So everybody has to have Part A and Part B in order to be on a supplement or an Advantage plan. So Part A and Part B, that is all done through the government. You go to Social Security, you sign up for Part A and B. That's all done through the government. I actually don't have control over that. Once you sign up for Part A and B and you get your little red, white, and blue card, that is where I come in. I help to guide you with either a supplement plan or an Advantage plan. It's one or the other. The supplement route is your lettered plans. for example, Plan G, that is going to have an additional monthly premium in addition to Part B. Then you also have to have a standalone prescription drug plan, regardless if you're on prescriptions or not, or else there's a penalty. That can also have an additional monthly premium. I describe the supplement route as car insurance, for example. So it's kind of a good analogy. You're going to pay for your insurance regardless if you use it or not.
Yeah.
But knowing that you're covered, you can go anywhere that accepts Medicare, but you just pay it and you are covered. Then the other option is the Medicare Advantage plan, the Part C, the Cadillac plan. Those basically have little to no premium. You only pay your Part B, as in boy, of that $185. It can go up depending on how you filed your taxes 2 years ago. But then your Part C usually doesn't have a premium, and you pay via copays. You only pay when you need to use your insurance.
Got it.
Okay.
So if I'm generalizing, which is definitely not a good thing, right? Because each person is unique. So if you're a healthy individual, just turning 65 and going into Medicare, to me it sounds like just, and if you don't need medicine, just the basic Part A and Part B, you'll be okay.
Well, again, it's only an 80% coverage. So we want to make sure that that individual has at least a supplement or an Advantage plan to make sure that in the event something catastrophic were to happen.
If you're into an accident, if you fall from the stairs,
yes,
you don't have to pay the extra 20% of the ER or emergency room.
So if you were on an Advantage plan, you would pay a copay for that, but it would go towards that max out of pocket. Now, if you were on a supplement plan, again, you can go anywhere that accepts Medicare. So, but you definitely want to make sure, and we highly do encourage you to make sure that you are either on a supplement or an Advantage plan.
From the get-go, from the start.
Exactly, because again, in the event that something catastrophic, there's 20% that's not covered. Does that help clarify?
Yeah. Okay, that's good.
Great.
And then, as we know, as we get older, we start changing and our needs start changing. So one of the important things that I think you bring is that you need to reassess your needs every year and see what other options you have, right?
Yes.
So walk us through that process. Is that really every year, or as your health changes, you need to be aware of that before at the end of the year when you have a chance to change plans?
Yeah, that's a great question. So as you had mentioned, that yes, people's needs are changing, their medications are changing, they're aging, that kind of thing. So as a broker, we do offer free plan reviews every year. So every year in the fall, it's October 15th through December 7th. That Perfect is the timing. It's right around the corner. That is the big time every year. It's the annual enrollment period. So this is the time to change your plan. And if you do change your plan, your new plan starts January 1st. So we always encourage individuals to schedule a free plan review. That way we can really sit down and talk about their current health, any kind of changes that happen within the year. And we would compare what their plan is to what their plan is going to be changing into 2026. The Advantage plans are always changing. And so we want to make sure that we really do compare plans and make sure that that individual is on the appropriate plan for them. If you're happy with your plan, you will receive an annual notice of change. Everybody does receive that. If you're happy with your plan and you reviewed your annual notice of change, you don't have to do anything. It just automatically rolls over.
And how long is the annual enrollment period?
Great question. So it's every year. It's October 15th through December 7th.
Okay, so it's about 2 months.
Almost 2 months.
Yeah,
Yes.
Now, what are the typical missed savings opportunities that people don't take advantage when they have a chance to change plans?
Sure. Well, I think what's really important to know is the different enrollment periods first, to definitely speak of that. As you're approaching the age of 65 and you are going to go on to Medicare, you're in what we call their initial enrollment period. And so it's a 7-month window. So there's a 3-month window before. Okay, so let's say their birthday is in April. So they can start signing up for that A and B starting in January. So it's January, February, March. They can sign up. They also have the month of April, their birthday month, and then they have 3 months after. So May, June, July. Okay, so they have that 7-month window to sign up. And so at that time, we look at if they're wanting to do a Plan G or a supplement plan, we look at premiums. Okay? So we look at the cost of what their Part B is going to be, And then we do look at the cost. If they want to do the supplement route, we look at what the premiums are, and especially for that Part D as well. So we do look financially, we calculate everything up roughly of how much it's going to be.
Okay.
And then the Advantage plan, again, those you're paying your Part B premium, but with those we really do look at that max out of pocket.
Yeah.
We also do look at the prescription drug plans because those do have a max out of pocket as well, but there are co-pays with that as well. So it's very important to look at that as well for finances and cost and that sort of thing. Throughout the year, there's other election periods as well. So
but this is just at the when you turn 65. Mm-hmm. Once, if you're in your 70s, you don't have all these options. You just have the enrollment period at October to November. Fall.
Yeah. Unless so let's say I was to sit down with your mom during the fall and we would reanalyze her actual plan. Mm-hmm. If she was on an Advantage plan and she was happy with her plan, then we wouldn't do anything.
Yeah.
If we wanted to change her plan, we would change her plan. It would take effect January 1st.
Okay.
Now, let's say your mom was on an Advantage plan and she moved out of state. That would actually qualify her for a special election period. Okay. And that's throughout the year. So anytime your mom moved, if she moved out of state or even out of the county of where she lives, because Advantage plans are county specific. So it's very important to note that if they move out of their county or if they move out of state, we do have to change their Advantage plan. Okay. The supplement route, that Plan G, that goes with them wherever, whether they move out of state or if they move out of county, that stays with them. However, it's important to note that prescription drug plans with that supplement, that Plan G, that is county specific, just like an Advantage plan. So we would have to look at changing the plan as well if they moved. Okay.
Yes. Check. Oh wow, this is really interesting. So now I'm gonna ask you so this is county based. Okay, so what I'm hearing is that if you are, these Advantage plans are location specific, county, state. So that opens a new question, which is how are these plans dependent? Are they different between Kaiser Permanente, Cigna, all the different options that you have? Does the coverage really changes, or is just the same? And what you really have to look is, are your providers within network of that insurance? Is that the real difference, or there are other core differences between insurance companies?
Yeah, that's a great question. So each insurance carrier, they do have, the Denver metro area, they have north, they have south, they have, the western slope, that kind of thing. But each insurance carrier, their counties they do differ from insurance carrier to insurance carrier. It's not all the same. And so when I'm sitting down with you first, I look at your doctors and your prescriptions, and then I take that information I'm able to look up to see which Advantage plans where your doctors are covered and your prescriptions are covered. So my hope is to have hopefully all of the doctors are covered. If not, then we do really go into detail of this doctor is not covered, or they're in a network or they're out of network. And then I do look up to make sure that specific Advantage plan is specific to that county that they're living in.
So it really makes a difference, Advantage versus supplemental, because if you're in Advantage in a place that provides more support, in a city that's more supportive of seniors, it will be different than Advantage at a location that it doesn't have the same resources, and therefore maybe the supplemental might be better.
It can. It definitely varies facility to facility. Like regular Medicare, the supplement route, again, you can go anywhere that accepts Medicare. The Advantage plan, it is a network based, and so it's very important to make sure that the client is fully aware of, my doctor's in network or their doctor's out of network. So that is extremely important to check that with an Advantage plan.
Got it. Okay.
And you're right. Kaiser. You can only go to Kaiser facilities. With Humana or United or there's Aetna. There's a whole bunch. Devoted, that kind of thing. That is really just contingent upon if that specific doctor's office or that facility that they're going to actually takes that specific insurance carrier.
Okay, so now let's talk about life events that trigger reassessment. We talk about moving, so that you move, then you have the chance to change plans.
That qualifies for a special election period, is what we call it. Yep.
What else is special, allows you to change plans?
Yes. So if somebody decides to stay on their group insurance past the age of 65, and they don't get onto Medicare, but they do decide to work past the age of 65 and they're on their group insurance. But when they do retire and they need to come onto Medicare, that qualifies them for a special election period, because at that point they're most likely past that 7-month window of their initial enrollment period. And that's okay as long as they've continued to work past the age of 65. And the most important thing there is that they've had credible coverage. And what that actually means is that the employer that they're working for has 20 or more employees. That is the most important part. That is considered credible coverage. That's what the government wants to know for when they go to sign up for that Part B, that they've had credible coverage past the age of 65. And so there are forms that you need to submit with your Part B to prove that you have had credible coverage. If you haven't had credible coverage, there is a penalty for that. So
for changing,
if you haven't had credible coverage past the age of 65. But that, as soon as someone retires and they've stayed on their group insurance and they retire, that does qualify for them for a special election period, and that is obviously the retirement coming off their group insurance. And some other qualifications is, let's say an individual is, late 70s or something, and they're at home and they're moving into an assisted living, and they need to change their plan. They're moving, okay? So maybe they're on a specific insurance carrier, but they're moving to a facility, but they don't take that insurance. And they only take insurance A, B, and C or something. So that would qualify for them for a special election period.
Got it.
If someone was diagnosed with a chronic condition, maybe diabetes or chronic heart failure, there are Advantage plans where it does qualify them for a special election period, where if they were diagnosed with something like that, we could put them on a different plan at that time.
So this is important. So if I go to the doctor and I get diagnosed with something that I know is going to be impactful and very expensive, I have the chance to change my insurance so it works better financially for my situation. But I will go to you to help me navigate that. Is that right?
It would be contingent upon your diagnosis. So again, it would just mainly be if it qualified you for a chronic condition of what the insurance carrier designated as a chronic condition. Each insurance carrier actually labels that as a little bit different way. And so let's say it was diabetes or chronic heart failure, which is common for these chronic Advantage plans. Then if you were diagnosed with something like that, you would absolutely reach out to me, and we would basically look at those plans, look at your doctors again, look at your new prescriptions again, because there are some plans out there that do help you financially if you've been diagnosed with a chronic condition.
Things like all the support that you need for dementia. Now, that's another good question, is like, how do you cover like home care support, medical and non-medical? Is this covered by insurance or private pay? Especially in cases of dementia where you're going to need more support, even if it's not medical.
Sure. Some of the plans do offer home health care where they would come in. And then other options is to work with a financial advisor and look at like some long-term care, especially as you're, again, this is for actually anybody that, is younger, like in their 40s or their 50s, to look into long-term care, so that in the event that you did get dementia and you had to be put in a specific facility or something along those lines, you would have that other option of that long-term care to help pay for some of those finances. But as with Medicare, it's really medical, and it's really specifically if your plan does cover the home health care. And not all plans cover it. So it really specifically is that something of interest of somebody coming into your home. And that was, again, just part of our Medicare 101 with me gathering information, looking at those plans that do cover that home health care.
And that's part of the reassessment of every year that you want to do. Is like, if you know that you're going to need more support next year, now is the time in the fall to really reassess what you have and what you're going to need in terms of home care. So let's dive a little bit deeper into that. The support that's needed with dementia or non-medical support, companionship or like support, washing the dishes, all that help that you need at home. some of that is covered by insurance, or typically that's not, that's out-of-pocket expenses?
If the plan does cover, like let's say they cover 30 hours in a year or 40 hours in a year, so a couple times a week, maybe an hour or something. You can break it up or however you would want to. But again, it's really specific and contingent upon that specific plan.
To the plan.
Each plan offers a different amount of hours, and some plans don't even offer the home health care. So there's other resources out there though, outside of Medicare that, other people that, we can have you bring in and have you interview as well that do help assist with those things.
Yeah.
And that would be more or less like an out-of-pocket thing.
Okay. Yeah, I think that's another topic that needs to be covered. So because let's say cognitive disabilities, they are considered medical, but the support that you need might not be medical, right? So that's where the difference. Your visit to the neurologist might be covered.
The medical piece of it, but the
support around the care is not covered. So that's important. That's something that's critical.
And there's different facilities out there that do offer, like dementia care or anything like that. And so, it would be really nice to work with an individual that has that experience in those type of care programs. And I do work with many individuals that are a part of that community. And so, again, working together to make sure that they make sure that they take whatever specific insurance that they were on, and then they're able to provide other resources as well for the care part of it. Yeah.
So I know cognitive dementia is one. What are kind of the other big areas that additional consideration?
I just hear about the homes with the dementia, with the memory care. That specifically, that is probably like one of the most popular ones. Other than that, it's just really an individual that just can't be at home anymore.
Right.
They have to move into a facility because they can't take care of themselves, or they don't have a caregiver that comes in and can help them.
How about nurses that home medical care? Is that covered by insurance?
That falls under that home health care, under certain, so it would be a nurse that would come in or anything like that. But again, it would just be contingent upon the plan. And only a certain amount of hours per week. If somebody needed, home health care, again, there's just other resources, and again, another interview opportunity that I can absolutely help refer you to. Absolutely.
And, like a stroke, or if you're recovering from surgery or from a fall, hip replacements, back problems, that can be limiting for the person living at home. And if they're by themselves, it's, even if family's there, it's not that they're qualified caregivers.
Yes, exactly. So usually if someone were to fall or they had a stroke or something, usually that individual would obviously be in the hospital for a little bit, and then they would actually move them to what we call a skilled nursing facility so that they could recover before they go home. Now, that is covered on both a supplement and an advantage plan. They're covered in different ways. The supplement route, the plan G, that is going to be, I think it's up to 100 days where they're covered, and then it's pretty rare that someone would actually be in a skilled nursing facility for that long. And then on the Advantage plan, they do have the first 20 days, there's no charge. And then after that, there is a copay, but again, your copays go towards that max out of pocket up until you were to hit that max out of pocket.
Got it.
Okay.
And how about physical therapy, speech therapy?
Yeah, great question. So that's covered. It just would be either a copay or obviously a facility where that covers Medicare.
Got it.
Yeah.
Got it. Okay.
Great question.
Let's see. So here's another one. So what happens if you're in an Advantage plan? You're covered around your home. You have your network, so you're happy. But if you go on vacation with your family and something happens in Hawaii or in Florida, and you live in Phoenix or in the Midwest, what happens in those situations?
Yes, so on both a supplement plan and an Advantage plan, you do have worldwide emergency room coverage. I always say that if you do travel outside of the country, you still have that, but I always would highly recommend adding in a traveler's insurance as well.
Sure.
If you're within the United States, again, you have the worldwide emergency room coverage. And then on an Advantage plan, you do have urgent care copay and an emergency room copay. Okay. So you have that. And again, with the supplement plan, you can just go anywhere that accepts Medicare.
Got it.
So, but you are covered, regardless if you're on a supplement plan or an advantage plan, you're just covered in a different way.
Got it. Okay.
Yeah. Yep.
That's interesting. Okay, so let's see. Here's one other. We have covered a lot.
Yes.
Any pitfalls or mistakes to avoid that you see people commonly make, and when you're helping them, it's like, okay, you're trying to make up for a mistake that they have done in choosing the wrong insurance. What are the common mistakes people make?
That's a really great question. Primarily signing up for Medicare as someone is turning 65.
Mm-hmm.
Whether it be just staying on Part A and Part B, thinking that they're fully covered, but they're not. Again, there's that 20% that's not covered. So that is a big mistake that people do make. Also, if you do decide to get on a supplement plan, it's very important to make sure you have a prescription drug plan, that Part D, or else there's a penalty for that as well. So again, regardless if you're on prescriptions or not, and you go on to Medicare, you either need a standalone prescription drug plan with that supplement, or you have one that's, again, in the Cadillac plan, the Advantage plan. It's already enrolled into that.
Got
okay. Another mistake that we see is individuals that don't have credible coverage past the age of 65. And so then there's a penalty for that. That's pretty rare. So if someone decided to not get onto Medicare, there is a penalty for that as well. And then just truly making sure that if you're wanting to change a plan, it is during a specific enrollment period. We have to wait a certain election period, whether they move or something along those lines. That's another mistake. Like we had talked about earlier, that if someone's on an Advantage plan and they move, it's imperative that we change their plan. A lot of people don't know that they have to. So it's very imperative to make sure that we, any kind of changes that you make, always just reach out to your broker to make sure, hey, am I okay? I'm moving to this county or I'm moving to this state, because we would definitely need to either switch your Advantage plan or your prescription drug plan.
Got it. Another aspect that I was thinking, and I don't know how much but as you're aging, going toward that 65 age, to me, it seems important that you start building up savings in like a health savings account, where you can start putting together kind of money that can then be used to pay for either the Advantage, the copays, or the supplement aspect, and that will be a tax efficient way to pay for these from your job and what you have done.
Yeah, I'm glad you brought that up as well. It's very important. Individuals that have an HSA, a health savings account, and they've contributed to it, their employer they have, you need to stop contributing to that 6 months prior to you getting onto Medicare.
Or you have to stop contributing.
Stop contributing. Now you can still use the funds, but you just can't contribute to it when you're on Medicare. And the rule is legally you have to stop contributing 6 months before you get onto Medicare. So that's a great question. But I do have folks that use their HSA to help pay for their Plan G premium or their copay or something like that for the Advantage plan.
Ideally, you want to build those savings over time, so that pays for that. Okay. Now, what advice do you have for families who they have loved ones that are going or are in Medicare? Any words of advice for adult children? The sandwich generation that they're still taking care of kids at home, and now they're taking care of parents. I'm one of them.
My advice would just to be educated in Medicare. Obviously, with what we've covered today, it can be very confusing. You're overloaded with emails, phone calls, that kind of thing, and so are your parents, right? And sometimes your parents have no idea who's calling them or anything like that. And that brings up another good point is there's lots of scammers out there. So it's really important to, again, work with a broker, and if you have any questions about your insurance coverage, to either call your broker or only call the 800 number on the back of your insurance card. There's 2 people that you can get answers from. If somebody calls you randomly and is trying to pitch a plan to you,
any phone calls.
Just say thank you so much for the information. I already am currently working with someone. Because whatever they're pitching to them, you can listen to them, but and if you have questions or there's pitching a plan to them, your broker will know what that means. Because again, we're very familiar with majority of the plans.
And I think
so,
the scamming is such a terrible one because there's so much targeting to this vulnerable population.
Yes. Mm-hmm.
When my mom is on the phone talking to somebody who is offering her, they promise
yes.
everything.
Yes.
And they are gullible and they start believing and they take their credit card and
yes.
send it to me. It's really scary. It's just like, yes, just avoid it.
And that's again where it comes back to why we always recommend working with a broker, because you've built that relationship, that one-on-one relationship, whether it's with you and me talking about your mom, or your mom is also with us and we're talking, and so we've built that rapport and that relationship with each other. And so it's just nice to be able to call a broker and say, hey, someone called my mom and said that they are eligible for this home and food card, where it's an additional, let's say $200 a month. Well, again, as a broker, you're like, oh, yep, that is for a specific Advantage plan.
Yeah, that's the thing that I have seen is like they promote all these benefits, discounts, or have this extra card where you can buy all these products at a discount. Many times they're products that you don't need, you don't use, and you feel the pressure of spending more money somewhere else on things that you don't need. So
and a lot of times, like those food and home cards that you can use on like gas, electricity, that kind of thing, that is specifically targeted to one group or a couple groups of people. It's not to the whole public. It is honestly for individuals that have certain conditions, whether it be a certain chronic condition that we spoke about earlier, or if it's an individual that has both Medicaid and Medicare together. Mm-hmm. They have different Advantage plans that are offered to them instead of just the general public. And so they have different benefits. Same with the chronic people that have chronic conditions, they have different benefits. But the way that, again, with the scammers work, they will use that as a point to get someone on the phone, and then before they know it, they're like, my plan got switched over, I have no idea what I'm even on. Yeah. So any types of questions that you have, it's always just nice to be able to call your broker and ask your broker, hey, I heard about this. Or again, if you can call the number on your 800 number on the back of your insurance card. So that's just the value of working with a broker, so that we're very well educated in this field, and we're able to help direct and answer any kind of questions that you may have, or the individual who is on Medicare may have.
Got it.
So
okay, there's another topic that I'm curious, and I think you touch on it, which is dentist and vision. Because every time it seems like my mom tries to go to the dentist, the coverage is very limited. It's like they don't like to pay for much, and they prefer you to lose teeth than to keep you with a healthy healthy teeth. So, what can you tell us about those other aspects which are important?
Yeah, so a couple different things. So remember, on a supplement route, your plan G, you would have to add in an additional dental, vision, or hearing plan on this supplement.
Yeah. So G plus another letter.
It would be another letter. It would just be your dental coverage, your vision coverage. Yes, because it's not included in that.
Okay.
And so I can also assist with signing an individual up. So some people need only dental. Some people need dental and vision.
Yep.
Some people need dental, vision, and hearing. And so there's packages where they do group them all three together, or two together, or if you just need one. Okay. And in that case, it really is contingent on when I'm looking at a standalone dental plan, for example. We're looking at, how much work do you need to have done? Yeah. Is it just you want to maintain like a basic coverage where you get your 2 cleanings a month and your 2 x-rays a month or a year, that kind of thing. And so there's different packages, again, that we can look at. Different insurance carriers, again, offer different things. So it is, again, very important that one-on-one to make sure that I'm fully aware of what kind of needs you need. In the Advantage plan world, each insurance carrier offers different levels of dental coverage. Some of them only offer preventative care. Some of them offer preventative and comprehensive. So if someone is needing a lot of dental work, we really definitely want to switch them over to a plan that has a higher dental coverage for sure.
Got it.
I don't like to base your health insurance off of your dental needs, because we are looking at your health insurance. But with the Advantage plans, there are plans out there that do have great coverage in addition to great dental coverage as well.
Okay.
So it's nice to be able to have that good combo. But that is all, again, great questions with during that first initial getting to know each other and really getting to know the needs of that specific individual.
Okay.
Yeah.
Okay, so let's close up.
Yes.
Is there anything else that you wanna
For that part, no, I'm sorry.
Okay. No.
That's such a great question.
Okay. Desiree, thank you very much for all the information you have given me and given us. If you guys have questions, please DM on social media, and we try to address those either directly or on a follow-up video. Any last words?
Thank you so much for having me today. If you guys want more information, you can absolutely check out my website. It is rediscoverinsurance.com. And I have all my information up there as well. So if you definitely want more information, you can contact me there. You can send a message, or you can also call me. So whatever, or email. So whatever is convenient.
Wonderful.
Yes, thank you for having me today.
Thank you very much. And we'll bring more guests and have more tools for you guys. Thank you very much.
Awesome. Thank you very much.